there. Julia Bagg and Marissa Bagg here from Moms with a Mic, and we are talking COVID and how it is just making challenging situations in our households, right, Marissa?
Absolutely. I mean, I think, at least if I can speak for my house, we were in a really good spot for Thanksgiving, still taking precautions, but felt pretty comfortable. And then as we got closer to Christmas, more excited about the holidays. And then I think we all got a real, taste of reality as to just how contagious this Omicron variant is. And not only were we hearing about friends and family members not being able to participate or even travel here, but we ourselves, had to make some pretty difficult decisions, start testing more often. And yeah, it just upended the holidays to a large degree. Right, Jules?
It did for our families anyway, right after the holidays. And we're also talking to a fellow mom that we can go ahead and bring in on this conversation with us, Angie Bradley. Hi there, Angie. Thanks so much for being with us.
We really appreciate just your time. We know we all have spoken in the last several days about your experience, and pretty similar to ours. And just wanted to say thanks and be able to share, with other families what we've all been through. How are you feeling about the last few weeks?
Yeah.
Well, first of all, thank you guys for having me. God, I don't know. I don't even know how I feel because just this morning I took another rapid test and I was positive. So it's like, I feel like the story has not ended, although I know at this point I'm not contagious. Thankfully, the kids started school on Monday. They all got tested as well. My husband got tested yesterday. So everybody's good. We're on our way out of it. But now the testing is just going to be constant. It's going to be every week. We just need to know and feel at peace that they're still negative at least.
Sure. And Angie, I got to say, I'm right there with you. We just went through this. Okay, great. We're all negative. My son can go back to his preschool. We can have my nanny back. But what I'm thinking is I just don't want to go through this again. I don't want to get it again.
Yeah, it was just one of four of us that got it. So myself, out of everybody. So now we still have three other people that could potentially get it, which means we would have to go through this all over again. And that's where the kind of stress continues to go through because you think, okay, good, we're out of it. We're in the clear. Had we all gotten it, but we didn't all get it. So you were still on that kind of, defensive.
Absolutely. Well, and Angie, the same thing happened with my family. My daughter tested positive a few days after Christmas. We were wearing masks in the house, which is so awkward, right? I have a 4-year-old. She had tested positive. My 1-year-old was negative. My husband was negative. I was negative. And that's the way it stayed for about a week. I guess we were able to keep her from spreading it to the rest of us in the house. But let me tell you, trying to keep my kids apart when we're always talking about sharing and playing together. Yeah. And then it's like, oh, but not this week because the pandemic, it's explaining that to a 4-year-old, let alone a 20-month-old is tough. So.
Well, I think we all live in homes that are maybe the size that you can even do that. But I think of other siblings that may be sharing a room or, living in spaces that are even, too tight to put them apart. And you just have to cross your fingers.
Yeah, I mean, that was our experience. And so, because we just have 2 bedrooms. And so it was my husband and my son who were positive. So they were in one bedroom. I stayed in the other bedroom with my daughter. We used separate bathrooms. They ate out on the balcony. We didn't eat together. We ate at separate times in separate places. And but ultimately we did all test positive. So that was rough. I'm thankful that we're through it. And in a little while, we're going to be speaking with an expert on this to get some more answers, for our families. Oh, Marissa, I think you're muted.
I think everybody responds a little differently, right? I immediately went into, separate and mask mode. Angie, I know in your family, you figured, we've already spent so many days together where we're already exposed. Are we going to try to isolate within the house, which is very difficult.
Yeah.
So you're under, pressure to make the right decisions for your family. And it can be so difficult at that time.
Yeah. But also, not only was I positive, my older son had tested positive for strep throat, and the baby was just a regular cold. So it wasn't even like I could be away from either of them anyway. So it was like there's just no isolating anybody in this household. Either we get through it together and we all get it, or cross our fingers and nobody else gets it.
Right, because it's so hard to isolate, to separate, and you're still having to care for your sick children.
Yeah, for sure. And my husband's the one that cooks, so at least that part was handled. But the other part was difficult, giving the medicine, trying to get them to take what they needed, each of them, putting them to bed. It was rough.
So let's go ahead and bring in our expert, Dr. Kanjana Mavunda. She's just an amazing, brilliant doctor. She's a pediatric pulmonologist with Kids Medical Services. Thank you so much for joining us and just being able to share with us your expertise.
Thank you. Thank you for having me. And it's really nice to listen to your experiences. One of the ways I learn, besides listening to the science, is also talking to the parents and how they handle things, etc. So when I have a patient who has exposure to COVID, I do like to ask them about where the exposure may have been, and then also know the patient's and the family's history. Like whether they were vaccinated or not, how long ago were they vaccinated, if they were vaccinated, have they had previous COVID infection, things like that. The good thing is that young children less than 2 years of age, they tend to have mild disease if they have symptoms. I've actually had quite a lot of premature infants, less than 6 months of age, that have had exposure. Some have tested positive. Some parents didn't even test, but they did not have any increase in symptoms. And part of the reason is that there are special cells in our airway that facilitate the virus to enter the body. There's a specific enzyme that makes it easier for the virus to get into the body. Children don't have that enzyme, or they have a very small amount. So then it's harder for the virus to enter the body and cause problems. The other thing, being a pulmonologist, my kids already have respiratory illness, and that's why they come to me. And many times they're on medications like inhaled steroids, which actually may help prevent or mitigate the symptoms of COVID infection. What's interesting is that the COVID virus has been changing. That's why, we had the Delta wave, and now we have the Omicron wave. And the Omicron is very different than the Delta. It is extremely contagious. Delta was infectious, but not as contagious as the Omicron. Delta caused more problems. The Omicron, and this is just my clinical experience, I'm just telling you what I have seen in my patients. So it's like my epidemiology background and my questioning, etc. So I don't want to I'm just talking with my experience and with the knowledge I have. So what happened is that when we started seeing Omicron, we had a peak, it started peaking early December, and it almost felt like everybody got sick. Even
Mm.
people that were being cautious
Yeah.
were getting sick. And part of the reason may be that there might be a higher viral load in the environment. So what happened is also people were being less careful about their masks, about the social distancing, etc. So if you have the amount of illness you get will depend on the viral load that you're exposed to. So, for example, in schools, if you have school age children, especially like between like this up to 6 years of age, who may not be good about wearing their masks and who may not be good about their hand washing, and they're going to play with each other. So they're going to, in a school setting, even if you try to separate them, the transmission of the virus within the school system is going to happen. And then these children will bring the virus back home. The vaccine is now available for 5 and over, but children less than 5, like in daycares and preschool, are not vaccinated. So as soon as they get exposed, they'll carry the virus in their system and they might not have symptoms. And we know that with the Omicron, you can start transmitting the virus 2 or 3 days before you have any symptoms. So, one of the questions I have is, as parents, it's so hard to isolate from the kids, but maybe everybody has had that exposure at the same time. But different people and different family members will respond differently to the exposure and the virus. So that's a question that I have. It's hard to isolate yourself, but it's already in the household. So something like the Omicron, if you have healthy adults that have been vaccinated and have immunity against some of the strains, and if the kids are younger, and you don't have anybody who is immunosuppressed or elderly or somebody with chronic illness, do you really need to isolate yourself? Like Angie.
From each other in the household, you mean?
That was kind of our thoughts were, if I have it, I've most likely had it prior to getting tested, because by the time you're tested, you have it, right?
Right.
Well, yeah, at least 48 hours before.
Yes.
And so my thought process was, I've been kissing them, I've been on top of them, for this whole time until now. I've now tested positive, and going backwards, trying to isolate now is just too late. They've already been exposed. Mm-hmm. And I figured my husband and I had been boosted. I may not be as contagious as maybe I would have been prior to the booster shot. I don't know. Luckily, I think we just got lucky and the kids, did not get it, but neither are vaccinated. They're both, 4 and 1 year old. So they weren't able to be vaccinated.
And that is something that we're learning. Unfortunately, there are many adults who choose not to be vaccinated for whatever reason. And now, when they hear about people getting infected despite the vaccine, they're going to use this as an excuse. Well, we said so. Why do the vaccines? We don't know anything about them. They're dangerous. They change our DNA. All these different excuses. So, I sometimes sort of try to, in my mind, look at the epidemiology and the family's history and try to figure out whether you're just a carrier for the virus or whether you're infected. And then when people talk about the breakthrough infection, if you're asymptomatic and you test just because you've had exposure and you have the virus test come back positive, is that really a breakthrough infection, or is it that you're a carrier?
Oh, I'd never heard that before.
Doctor, that was my case. I tested positive, but I was asymptomatic. So maybe that means I was just a carrier. And you were talking about, kids in schools. The three of us, we all have school-age children. Angie, you were just talking about, the mask for your son. So, doctor, talk to us about. We know now, all masks are not created equal. What do we need to know about that?
Okay, so there's a lot of different masks. There are cloth masks. There are surgical masks. There are the N95 masks that the doctors use. What we do know is that if it is a cloth mask that has one layer compared to 3 layers, there are certain cloth masks that have 2 or 3 layers. The more the layers, the less you will transmit. Mm-hmm. But then the 3-layer mask may become uncomfortable, so you may not use it properly. What I found very interesting recently is that when we wear the surgical mask properly, even then, you can transmit more than 70% of the germs from your mouth.
That's the mask that I've been using. That's the mask that my son wears as well.
Yeah. So the surgical mask, which everybody uses, still transmits.
So should we double mask? What should we do?
No. So what we have to remember is that you're using the mask to protect yourself. Mm-hmm. And that's a little bit of a mind change. We think about using the mask so that we don't transmit. Mm-hmm. I have started thinking about it that we use a mask to protect ourselves.
Oh, wow.
And I started thinking about that. Actually, I had gone to Universal with my daughter after New Year's. And they have a policy that everybody has to wear masks. And when you go through some of these lines, you're waiting in this internal area for an hour with crowded, so there's no social distancing. People sometimes don't wear their masks or they don't wear it properly, etc. And that's when I sort of started thinking, I'm in this area, I know I'm exposed, and I know how Omicron is so contagious. Mm-hmm. So I know I was exposed. And that's when I started thinking that the best mask is the best mask that you wear properly. If you have to cover your nose, you have to cover your mouth. And by doing that, you're protecting yourself. So don't worry about others, whether they're transmitting or not. Assume, especially with Omicron, that they're transmitting the virus. Just assume. So whenever possible, try to keep a little bit of distance from each other, but wear the mask properly. So I just wanted to show you a couple of different masks. This mask, I found it at CVS. It's a cloth mask, and it has 2 layers. Mm-hmm. This one is infused with copper. Supposedly, copper is anti-infective. So the thinking is that the copper infusion prevents it kills the virus when it gets here. Mm-hmm. The thing about this mask is that the area for the nose, it's something that you can close nicely. So it fits the nose very nicely. Mm-hmm. And then you have ear loops and this. So you put it on and you leave it there. So for kids, I think this is nice because it's there. And then the child, when they put the mask on, they have to learn to cover the nose and the mouth, but make this on the nose tight and this so that they can adjust accordingly. But the most important thing is to keep the nose and the mouth covered, which is what a lot of people don't do. There are certain masks that are cloth, double layered, that have like a filter for extra protection. So this you would think is a nice mask because it's double and with this, but when you put it on the face, I'll just take this out. It falls off.
Mm-hmm.
This is another cloth mask that has 3 layers. And this one is nice and it's very comfortable for kids because it fits the nose and you close it, but there's space here also for the mouth. So you can sort of breathe in it. Mm-hmm. The surgical masks are good if you put it properly on the nose and the mouth. And remember that it's for our protection. So it doesn't matter that they only, transmit all these. We have to keep our masks on. So those are the best masks. And then, and the nice thing about the surgical mask is that you can sort of adjust to your face and stuff. So,
well, Dr. Mavunda, it's interesting. The CDC director addressed this yesterday. I was listening in on a White House briefing that she had with the COVID task force. And one of the questions was, do we need to get an N95 mask out to every American? And her answer was, and it was really interesting how she said it too, because she said exactly what you just said. The best mask for you is the one that is comfortable for you, and you're going to wear it for long periods of time if you're around other, in those settings where it's required. So it sounds like instead of trying to push a particular mask out on people, they want people to make the right decision for themselves.
And so with the N95s, there are so many different N95s. Before the pandemic, when we were in hospitals and stuff, we used to wear the N95s when we were doing procedures and stuff. And then if we had exposure to people with tuberculosis or something, we had to have it specially fitted. And we were told that you could only use it for one time and then you could throw it away. And now they say you can repeatedly use it. So there's, still a lot of information to learn about masks. But there are different kinds of N95. So this is an N95 that is actually really good. It has a metal strip here that it closes the nose and it really fits the mouth very nicely. But this is a mask that is very uncomfortable. I wear it sometimes in the office, but as soon as the patient leaves, I'll take it off because it's so uncomfortable. This is another N95 that is more comfortable. And then this is another one that my nurse practitioner likes to use. So there's a lot of different masks. These are expensive masks, and sometimes you're not able to get them. So again, it's how you wear your mask is the most important thing. So, and I would suggest not using a single layer face mask. I would do at least 2 or 3 layers, or the surgical mask. And then for kids, they have some ones where it sort of, with a headband in the back, so it stays tight and stuff like that.
So I have a quick question. When we're trying to protect ourselves, does the virus go into the openings of the mask or actually through the mask? Like
through the mask.
It's through the mask.
Especially if you have that single cloth.
Yeah.
It just goes out.
It goes through. It's not
and
even.
It also depends on what sort of symptoms you have. Like if you're talking softly and you don't have increased secretions, then there's not going to be much stuff coming out. But if you're sick and you have a lot of congestion, and especially if you're talking loud or whatever, that flow will be more. So there'll be more stuff coming out. So that's why, like, for example, when I'm in an elevator, they say not to have more than 4 or 6 people. It's good to isolate, but I hate it when people talk in elevators and, people are on the phone and whatever. But in closed areas, keep your mouth closed.
So, doctor, it just sounds like the masks are more effective, that they're not as effective at stopping the virus from on a sick person from getting out, but they're actually better at protecting someone who's healthy from that virus coming in. Am I understanding correctly?
Yes.
Okay.
Yes.
Because right. And I remember early on the thinking was, I will protect somebody else by me wearing a mask. But now you're saying we're really flipping that thinking, and it appears the protection is for the person wearing the mask.
Yes.
So I have a question that actually came in online that I want to share with you all. And we did talk about it a little bit a short time ago. It has to do again with, do you isolate from a family member essentially who's tested positive or been exposed? So this is coming from Lindsay Chapman. Her question is, even if a parent has possibly exposed a child prior to the parent testing positive with a breakthrough infection, should we try to minimize risk of exposure, wear the N95, isolate in different parts of living spaces in a house, or is it just too late? What would be your best advice for Lindsay?
You need to isolate from, stay in different, I am really sorry, hold on.
No problem. Life goes on, right? We continue to have to work through our workday. I'm honestly surprised no children have popped in just
Sorry.
yet.
Mine's sleeping, thankfully. So
Mine too. Mine's sleeping.
So, by this time, the person has already been exposed. If you are having symptoms and stuff, you definitely need to stay away from everybody. And if you have
you're in high demand, doctor. It's completely normal, right?
Yeah. I'm going to just put this away.
No problem. And I know just the three of us kind of handled this a little differently, right? Angie, your response was, we've already been exposed. That was the best decision you felt like you could make for your family without losing your mind.
Yep.
And we tried to isolate over here, and ultimately it just didn't work. We didn't have a whole lot of space, and we did all test positive. But most of us, that I would say, my son, my daughter, and I had mild to no symptoms. My husband was the only one who had any symptoms, and even his symptoms, thankfully, were mild.
So I think by the time you get your symptoms, you've already had exposure, so you would know how they are going to do. If you do have a lot of the cough and stuff, then you need to completely stay away, like in a different part of the house, etc. The other thing is that sometimes you can have more than one infection. So you can have the COVID infection, but you can have a secondary virus as well. Or like in your case, maybe the strep throat. Is it the strep throat that's causing the illness? Is it the COVID? Could you have had a false negative COVID test?
Yeah.
So, just look at your situation, look at how the exposure was, what the symptoms are, what your immunization status is, what if you have immunosuppressed or people who are going to have more complications if they get sick, then think about it. So if, in your household, for example, if you had, let's say, an 85-year-old who's recovering from cancer, then you definitely need to stay as far from that person as possible. But because the children seem to, the younger children have less chance of getting sick, and they're doing okay when you find out, it may be okay to just observe. And that's what actually a lot of my parents have done. And when I do telehealth with the parents, they have the mask on, but they're still with the baby, and the mask is not on properly anyway. And again, we know that the masks don't work. So in that case, are you going to get the N95? But those N95s are quite uncomfortable for long time use.
I have a question, doctor. So the fact that I was boosted, I guess.
How long ago did you get the booster?
I got it like 3 weeks ago, like a week before I tested positive.
And then, can I ask which vaccine you had, whether it was Pfizer or Moderna?
I had Pfizer for the first time in April of last year, and then I got the second dose, and then I got the booster. They were all 3 Pfizer.
Okay.
The effects of the booster were much stronger on me than actual COVID. But my question was, could that have helped in not transmitting to my husband, who's also boosted, and to my kids? Could that have been one of the reasons why they did not
been?
get
And
it?
again, maybe 2 or 3 years from now, we'll have a lot more information. So it's all speculative, but it could have, it most likely helped. Can I ask, the exposure that you had, was it in a crowded area or was it a significant exposure?
I don't know. I don't know exactly where it came from, but I was not in a crowded area prior to that.
And you work from home, Angie, correct?
And I work from home. Yeah, and I work from home, and I hadn't been in the office, particularly because I wanted to kind of keep exposure to people in general low.
And then are you good about wearing your mask when let's say you go shopping?
Yes, except for I'm not wearing the correct mask. So, maybe I was actually recently wearing the one that seems like neoprene, which seems to be like not a good one, or the surgical one. And I don't know. I don't know. I may not have been extremely exposed, and I had like I don't know.
Yeah. The surgical masks do protect, so it's not a bad mask. What I was going to say is that when the manufacturers for the different vaccines started talking about their vaccines, initially at the beginning, there were more than 20 different vaccines that they were working on. And what they found was that the Pfizer vaccine was actually much better at giving immunity in the upper airway as well as the lower airway. Moderna is very good as well, and Moderna may be better for certain strains, but according to the basic science, Pfizer gives better immunity in the upper airway, which is great for kids because now we have the Pfizer available for 5 to 12, and those are the ones that transmit the disease.
So, and Dr. Lavanda, I have another question kind of going off of what Angie was saying regarding, do you think her booster helped maybe protect her family from spreading it to them? But I'm curious. I've talked to people who say, I'm vaccinated, fully vaccinated. I got my booster and I still got COVID. I still got Delta. I still got Omicron, and it was fine. I didn't have, any major sickness or disease involved. I, maybe had a couple days of a cold. But is it safe to say that because this person was fully vaccinated and because they were boosted, that's why they had an easier time dealing with the virus?
Yes. So again, what happens is that if you have that immunity in the nose and the airway, your body's antibodies, and that's the point of a vaccine, to boost the immune system, our own immune system, to fight the infection when you get it. So that's how the vaccine works. And the booster worked because it helped. As soon as the body saw the virus, the body's immune system revved up and took control of that virus. So I was actually surprised to hear that you still had a positive antibody test. I've not heard that. PCR, you can have positive for a longer period of time, but I've not heard about an antibody being
I don't
positive.
know. So the 30th was the first day I tested positive.
Uh-huh.
And an at-home test. The next day, the 31st, I did the PCR, tested positive. I have since then done antigen tests because they've all come out positive. And I know that if I go get a PCR, it's almost 100% going to get positive. So this morning, Tuesday was the last time. And this morning I said, okay, great. I'm ready to see no second line. It's almost like a pregnancy test that you're like waiting to see. And when I saw the second line, I said, I can't believe it. I can't believe that I'm still positive. I mean, I understand, and correct me if I'm wrong, I am no longer contagious, but I still have the virus I'm still shedding the virus. Like, is it still in my body? What is?
If you're not shedding the virus, it's just there. But let me ask you, which antigen kit were you using?
Originally, it was the Bimax.
Binax,
And then the second one, I've gotten rid of the box. It's a different one. It's one that actually has a liquid, and then first it's the stick, then it's like a strip that you leave in for 10 minutes.
And with that test, is there a control?
Yes.
And the control was negative?
The control is a blue line, and then if no line appears underneath, you're negative.
Okay.
If a second line appears.
Okay.
But also on Saturday, when we all went to go get tested at a location that does the antigen test with the drops, I tested positive there too.
Yeah. I don't know what to say to that.
I don't know either. But I did ask, because my brother-in-law is a doctor, and I was asking him, can we see my parents? It's been almost 3 weeks now. My parents are boosted as well, but he said, and he just advised that if we do go, to just for me to be masked, just
and for them to keep their masks on. Yeah. That's like your parents. I learned from them.
Yeah.
They're dying to see that their grandkids. We usually go there once a week on the weekend, so they keep asking me, and I said, I don't know. I test. My father doesn't even believe it. He's like, no, your tests are wrong. I said, I don't know what to tell you. So if we do go this weekend, we're gonna stay
in an outdoor space.
Yeah.
And make sure they have good masks.
Yeah. And that would be following the CDC guidelines, right? The 5 days, you're well past your initial 5 days of symptoms and testing positive, another 5 days of being, we're going on 3 weeks.
We're going on 15 days now.
Yeah.
Yeah. So yes, I would agree as if I'm the expert, but it's better safe than sorry. Try to be outside.
Yeah.
A lot of the gatherings that Julia and I do, with our families, our mom has this great back porch that we've used for years and years. So it's easy for us to be outside. And thankfully we're here in South Florida where it's 75 degrees out today. And it's certainly easier for us to be outside.
Yeah, absolutely. And you know what? I do want to add to this a little bit, just for Marissa and I. Our mom right now tested positive for COVID. She cares for our aunt who's disabled. And at first our aunt tested positive. My mother was negative. And then now our mom is positive and our aunt is negative. And it's just so frustrating for them, doctor. So nobody's going over her house.
So if your aunt was positive and now negative, she was able to fight it, which is what the vaccines help do. And now she has extra immunity. And then I had read somewhere, and maybe there is a sort of silver lining to all of this. What I've read is that when you get the Omicron after you've had the vaccine, your immune system is like a super boosted. So if there's a next strain or
I hope so.
It's going to be better. The other thing I wanted to just remind you and the parents, there are a lot of different coronaviruses around. Before the pandemic, there's a test that we do in children to look for different viruses. And that test actually tested for 3 coronaviruses that were circulated in the community. So, for example, most parents have had kids who have had the hand, foot, and mouth disease.
Oh, yeah.
That's a coronavirus. So,
really?
Yeah. And that one you can get recurrent.
Yeah.
But they fight it off. So if we're hoping that the Omicron is going to boost all of our immune system, and now so many people have been infected, that maybe we'll be able to fight the next strain better than so far, and see what happens.
Doctor, as far as kids are concerned, are we still as worried with things that they touch?
Always.
Okay, so it's just as important.
Yes. All respiratory
So
viruses, whether it's the COVID, the flu, RSV, those viruses, they cough or sneeze or touch their nose. They have it on their hand, then they touch a surface. Some of these viruses can survive on the surface for a long time, several days, in fact. So that's why where you touch is very important, because you don't know, especially in a daycare or pre-K or something, you don't know who has touched that surface.
Yeah.
And we're supposed to be doing this enhanced cleaning and stuff like that, but I think people are so fatigued at this time that I don't think that happens as much as it should. So yes, what they touch is very important, and that's why the hand sanitizer wipes or hand sanitizer, soap and water, that's a good habit to get into, for this virus and for future viruses that may come into play. And we're talking about the coronavirus, but they're also starting to talk about the bird flu that might come up sooner, at some point. So all the habits that we're learning now are helpful. The other thing, if I may mention, as far as the flu vaccine is concerned, for healthy children and adults, there is a flu vaccine that you give in the nose. It's drops that you put in the nose, and that actually gives better immunity than the injection. So, I was really pushing the nasal flu vaccine for my parents and patients, because I was thinking that if you get it in the nose, your immune system in the nose is boosted, whether it's just boosted. So then that may help against other infections, other respiratory infections as well.
Do you request that from the pediatrician, or do they offer it? Because my son got the flu and I didn't have the option.
It wasn't available for a couple of years, so most pediatricians stopped using it, but it's not available the whole time. It's just available for a short period of time. So but it is available during the season, usually like from August to January.
And doctor, while we're talking about medicines, we do have one more question I want to get to before we have to close out. It's coming from a mom named Esther. She said, what medicine is good when you have COVID? What should people be taking? And is it the same for children and adults?
So the Pfizer medication that came out recently, that's good. That's really a good medicine for healthy people and children 12 and over. It's not available yet, but that helps. There's nothing really that has been proven to be helpful, but some people, inhaled steroids may help, and then just rest and good nutrition and stuff. Inhaled steroids, oral steroids may help, but of course they have to be prescribed individually. So you can't really say for the media, everybody. It's an individual decision about what to use.
What about boosting your immunity before you get it for kids?
Boosting your immunity. So,
are you talking about like zinc or, that?
Yeah, like, do you give kids something to make their immune system stronger, their defense system stronger? Because for instance, I don't give anything to my kids, but maybe I should be giving them vitamins.
No, so as long as they have a healthy diet, with lots of fruits and vegetables, a diet with color. Mm-hmm. All those colors have different products in them that help the nutritional system. It's better than taking supplements sometimes.
Really?
So you can do that. Of course, with kids, sometimes it's hard to get all of that in, but a diet that has a lot of color, fruits and vegetables, lots of fluids, and the important thing is rest, exercise and rest. They need to have good quality sleep and proper sleep. Sleep helps the immune system. and liquids. Of course, drinking like vitamin C, orange juice, nutritional stuff. Some people do give zinc supplements, and that may help. We don't talk about it so much now, but echinacea. Echinacea seems to help boost the immune system, and that it doesn't have harmful effects, except you can only use it for 2 weeks. So if you know that your child has been exposed or is going to be exposed, you could start the echinacea for 2 weeks, up to 2 weeks before. But if you use it more than 2 weeks, it actually decreases the immune system.
Okay.
Oh, wow.
Gotcha. Doctor, thank you so much. So I'm thinking of that rainbow diet. So don't get rid of the purple sweet potatoes, even though they're so messy. I'll keep giving them to my daughter. We just want to thank you all so much. Doctor, thank you for sharing your wisdom. Angie, thank you for your excellent questions and for kindly sharing your family's experience. And I'm just really grateful. I feel like I learned a lot from this conversation. Marissa?
Absolutely. And I've been getting messages and there's comments of people just saying thank you. I even have one friend who texted me and said, I love this doctor. So you've got some fans out there, Dr. Movanda, that's for sure.
Thank you so much. It's really a pleasure to talk to you. And like I said, I learned from you. So Angie, I learned something and now I have to do more research and figure out what could have happened.
Well, if a doctor of your level says that they learned something from me today, I am set. It's made my week, my day, my month.
Thank you.
And we will continue to be careful, obviously encourage people to get vaccinated and boosted if they're not already. Wear a mask, multiple layers, and of course, keep washing our hands and stay out of crowds. It's the best we can do at this point.
Yes, personal responsibility.
All right. Thank you all for joining. It really was a pleasure. Take care.
Okay. Bye-bye.
Bye-bye. Thanks so much for